Hey guys, I'm just about to invite Dr. Badawi on, and we're going to talk. Here we go, sorry. We're going to talk about what treatments we recommend pre and post menopause. There he is. Amazing. Hi,
Hello.
how are you?
Hi, Amy. How are you?
I'm good, thank you. How are you?
Very well. Thank you very much. I hope everything is going well at your end.
Very well, very hot.
Yeah, very hot today. Indeed, it's very hot today.
Yeah,
But
yeah,
good. Corona is improving. The situation is much better now.
good.
So I think
Yeah,
we are in Canada in a good situation regarding that.
I
Uh,
agree.
yeah, we moved to stage three in most of the places. So the restaurants will start to open soon,
Yeah,
which is great.
yeah, it's exciting. It's
Yeah.
exciting for restaurant owners and for everyone wanting to get back to a little bit of normality.
Exactly,
Yeah,
exactly. Yeah, yeah, yeah,
yeah,
yeah.
yeah, good. Everything's good on your side?
Yeah, everything is going. I'm starting to prepare for traveling. I'll be traveling again on 4th of August for a
Yes,
few weeks.
yes.
I have been here in Canada for the past 5 months or so, so it has
A
been
long
long.
stretch. Long stretch for
Yeah,
you.
yeah.
Yeah,
Great,
excellent.
great. Yeah.
Excellent. So,
I heard that you are starting to play with some new toys, with some new
I
devices. That's smooth. I'm
am.
very excited about that. I know that you're going to get excellent results with the Divine Pro and with the Oxygeneo. Those
Yes.
are really very good devices, which I'm sure that you are going to get excellent results with them.
Yeah, I agree. I agree. It's been a lot an adventure so far, and we've been getting some great preliminary results. So I'm
Excellent.
excited about the changes. Yeah, very exciting.
Perfect. Perfect.
Yeah,
Very good. Okay.
excellent.
So today I understand that we are going to talk about a very exciting topic which is the rejuvenation.
Yes,
And you are going to have some, we'll focus on the rejuvenation before and after menopause.
yes,
So
exactly.
I think it's a very important topic, Amy, and I really appreciate that every now and then you would like to tackle some important practical points which really concerns many people around us, and we have a very important role in making people feel better
Hmm.
and about themselves and about everything, explain things in a scientific and honest, sincere way.
Yeah,
So hopefully today we are going to cover as much as we can out of that topic.
yeah,
So
yeah. I'm
are
excited,
you?
and I'm not sure if you caught the Instagram live that Justin, our my natural path guru that we do our Instagram
Yeah,
lives together,
uh,
and yes,
yeah, very interesting, very interesting. Yes.
yeah, yeah. So, okay.
So if you are ready, I prepared some slides on my computer, which I think let us go through that and see what I have. If you have any comments at any time or any questions, please let me know.
Okay,
So
excellent.
so yeah, uh, I just want to make sure that the screen is clear.
Yeah,
Okay, is it
yep.
clear?
Mm-hmm.
So today we'll be talking about skin rejuvenation before and after the menopause. But before we do that, Amy, it's really very important to make sure that everyone is on the same page and we understand first what is the meaning of rejuvenation.
Yes.
Because in many cases, people come to the clinics, whether here in Canada or in any part of the world, and this was the trend for the past 15 years. They go to the clinic and they want to improve how their skin is looking, or they ask for a certain procedure, and then they get injected with toxins or with fillers or whatever the situation is.
Yes.
And then they get very nice results very quickly with minimal downtime, and then they keep repeating the same procedure every 6 months or every year.
Yes.
However, this created hundreds or thousands of people who are walking around us, and they don't look very natural. They look fake. Or if they decide to stop, then the situation is not that good, to the extent that they look older than their age.
The situation gets worse, right? Yeah.
Exactly, because the end point is always worse than the beginning. Why?
Yes.
Because there is an aging process which is going on, right?
Yes.
And if we do something to the skin in order to deal with some symptoms, with some manifestations of aging, however, we are not improving or slowing down or stopping the process of aging, then by the time this material, which was injected into the skin, is gone, then the situation is worse because the aging has been going on, right?
Yeah.
So
I have a question for you, if you could answer this for me as well.
yeah.
Just to kind of reiterate what I try to tell my clients, especially when it comes to lip injections, because we are augmenting the lips beyond where they are supposed to be naturally.
Yeah.
And I explain it very much like when a woman is pregnant and her body is changing and her skin is stretching, we have hormones that give our skin that pliability and that stretchability. And that's very important because that protects our elastin fibers and our collagen. However, we don't have that in our face when we're injecting something synthetic. And I get very, very concerned for women who are injecting their lips far beyond where they are supposed to be. And what the result is afterwards, because lip injections as well, the filler in the lips only lasts about 3 months.
Yes, that's very true.
So I think that, and like, I don't mean to interrupt, but I just think it's a really important, because you already kind of touched on that when it comes to the skin aging, when you have these fillers in the skin already. And I think it's really important that we are truthful to clients, because I don't think that clients realize what happens to the skin when there's injections.
Very true, very true. But this is what you mentioned is really very important. The lip injection is one of the common practices, and I think everyone can tell who has used fillers in the lips and who didn't.
Yes,
it looks really that there. I mean, it's very easy to tell that this woman has been injected with fillers in the lips.
Yes.
Now, this will take us again back to the question which is on the screen, which is, what is rejuvenation? When I inject someone with fillers or with Botox, is this rejuvenation? Definitely, it's improving how the skin is looking now. But is this rejuvenation? No. Rejuvenation means restoration of the structure and the function of the skin. This is rejuvenation. So if we did a procedure which improved the structure, so it will improve the function, and then it will improve the appearance of the skin, this is called rejuvenation. If we did something for temporary fix in order to improve some volume loss or decrease some expression lines, then this is symptomatic relief of something, but it does not improve the structure and the function of the skin. So it's not rejuvenation. And our goal is always to achieve rejuvenation. So anyone who's going for a procedure, whenever you are doing a procedure, your objective always is to improve the structure and the function of the skin, and this is going to prove how the skin is looking. Is that correct?
100%. And I just want to add, like, because I get this question a lot about my own lips. And so these are natural, and exactly, I'm always making sure that I'm using the rejuvenation process to restore and to keep my lips how they have been since I was
definitely
forever.
Yeah. Okay. So now one of the important things which we really need to keep in mind is that what we need to maintain and what we want to improve is the appearance of the healthy skin. And for the skin to be healthy, there are certain characteristics which we have to maintain or improve if it is not there. One of them, and the most important thing, is for the skin to be smooth. And that's why smooth is making sure that the clients are having smooth skin, right?
It's a good name for a business.
Exactly, yeah. So we need to maintain the skin smoothly. And in order to have smooth skin, it is very important to have normal keratinization. I'm going to explain that in a minute. But this is one of the important features of healthy skin, to be smooth. When it starts to become rough because of the hyperkeratosis and increasing the number of dead cells, then the skin is not looking healthy.
Yeah.
The healthy skin should be firm. And this firmness is coming from the abundant, which means quantity, and normal functioning, which means quality, of collagen and elastin. Collagen and elastins are proteins present in our skin, and they are responsible for the firmness of the skin. Okay? And this is disturbed starting from the age of 20. So starting from the age of 20, we start to lose 1 to 2% of our body collagen every year. And the areas which are exposed to the sun and the ultraviolet, the loss of collagen is doubled. And that's why the quality of the skin in the areas which are exposed to the light and to the sun is less than the quality of the skin in the hidden areas of the skin, right? So this is something which impairs the skin appearance, to lose the collagen and lose the firmness.
Yes.
Then the healthy skin is evenly colored. And this is one of the problems people present with around the menopause and during pregnancy, sometimes the melasma, where they start to come with hyperpigmentation, which is having certain characters, and a big problem in the patients, especially in patients with skin type 3 and higher. Okay, so this is another problem which can happen to the skin, to have hyper or hypopigmentation. Then the healthy skin is properly hydrated, and this requires intact barrier function. And this is something which we are always have to work on, because the barrier function of the skin is one of the important functions of the skin, which protects the internal body of the internal organs of the body. And when this is impaired, then the skin starts to lose water. When the skin loses water, it loses the elasticity, and this will lead to different problems, like loss of smoothness of the skin, like large pores, like fine lines and wrinkles, and sagging of the skin. So all this is coming from those structural problems which are going to affect the hydration of the skin, and the skin will start to be dry. Whatever moisturizers you prescribe, it's not going to work as long as there is structural defect in the skin.
So
right?
I want to touch on that a little bit, because I preach that all of the time. And a lot of the times my clients look at me like I'm crazy when I tell them to stop with the moisturizer. It's insanity, it's an addiction, and it's shutting down the natural hydration factors deep in the structure of the skin. And that we need to really focus on stimulating those base cells, and making sure that they're functioning properly, and that they have a healthy cell membrane, which is the fat of the cell.
Yes, definitely. This is something which people need to understand, that when we have structural defect in the skin, whatever skincare products you apply is going to be useless unless you are able to improve the structure of the skin. Then the functions will improve, then the appearance of the skin will improve. So this is the way we try to implement in our practice.
Yeah, okay. And just to finish up on, because that was one of the questions that came up as well about moisturizers. And so I'm not sure if you'll agree with me on this, but I only prescribe a moisturizer after an ablative treatment, or if we've done anything to impair the barrier function temporarily. But besides that, I don't recommend a moisturizer at all. I recommend more stimulants and more exfoliation practices and healthier diet.
I definitely agree with you. However, sometimes the patients and the clients, they need some sort of a maintenance skincare products to be applied. And sometimes they are puzzled. Sometimes they are under heavy pressure from marketing of different products, day cream, night cream, serums, retinols, and so on. So sometimes we have to just limit the number of products they apply and make sure that it is the correct one. And instead of just being, bombarded with hundreds of skincare products.
Well,
So yeah, usually the night cream will contain a good moisturizer in order to make sure that the skin is well hydrated, besides whatever structural improvement we implement on the skin from before,
yeah.
right?
Yeah. So yeah, my protocols are usually making sure that the functions, it's functional skincare, so that the functions of the skin are
Exactly.
working, and we're not suffocating the skin.
Definitely. Yes, this is for sure.
Yeah.
Then the next point is that the healthy skin is free of medical diseases when they have acne or atopic dermatitis or eczema or vitiligo or whatever skin condition or skin disease, it has to be treated because it doesn't give an impression of healthy skin when we have a skin disease. And finally, and this is the last point and the most important point, is that the healthy skin should be free of environmentally induced deterioration. Amy, how frequently are we exposed to the environmentally induced deterioration?
Every day.
Every day. Thank you very much. This is the answer of people who are asking you, how many sessions do I need and for how long is it going to stay? We are going to do certain procedures with the objective of rejuvenation, restoration of the structure and function of the skin. However, after those number of procedures, we will need to do maintenance because every day we are being exposed to insults from the environment. Every day we are aging one day. And if we have a process which is dynamic, which is the aging, then rejuvenation also has to be dynamic. So
Yes.
This is something which is very important. Now, before I move to the next slide, it's very important to remember that the skin is an organ and it has different elements, different functions. And in many cases, the clients and the patients are coming to complain of a certain or particular problem: melasma, large pores, skin laxity, dynamic wrinkles. This is their main concern, but it doesn't mean that this is the only problem they have. It is our role as people specialized in the skin to examine the skin and check which of the elements we are seeing in front of us are having a problem. Mm-hmm. Maybe they have melasma. Maybe they have a problem with the color, with the melanocyte function. However, they are not aware that the skin is not that smooth because of hyperkeratosis, or the skin has lost firmness because they have lost collagen, mm-hmm. or the hydration of the skin is impaired because the intact barrier function is not there anymore. It is our role to draw their attention that, yes, you came with melasma, yes, you came with acne scars. However, there are some other elements which need to work on in order to have a much more or much better appearance of the skin. Besides your problem, we need to work on other elements in order to normalize the skin, to restore the healthy appearance of the skin. And this is again, I would like to emphasize, because a problem like the melasma, we know that once melasma, always melasma. There is no cure for melasma, right? And if we do everything we can do for the melasma, there is a limit to the extent of the improvement we can achieve. However, if you are able to improve the smoothness of the skin, and we are able to improve the firmness of the skin, and we are able to improve the hydration of the skin, in this case, when this person is going to look at the mirror, then although we did not get rid of the melasma, we were just able to lighten it a little bit. But when they look at the mirror, when we improve all the other elements, they are going to feel happy. They feel that they are going to be seem to be younger about 10 years, right?
Yes. Yes.
So it's a collective approach. It's not a pinpoint. It is not a telescopic vision. Yes. So this is something which I always remind the patients and the practitioners, my colleagues, that this is the approach we are supposed to be taking.
Yeah. And I might add too that in the land of Instagram,
Mhm.
um, we have a lot of filters that we can use that
Yes.
are not real.
That's
So
extremely important point, Amy,
yeah,
because this is causing psychological issues.
big time,
We
and
we have
especially
patients, yeah, we have
yeah,
patients who think that their skin is awful, and then when I examine their skin, they don't have issues. But they show me photos of celebrities or bloggers or whoever on the Instagram and social media and magazines, no, this is with filter, with certain lightning, with special effects. And
yeah,
I always tell them, compare apple to apple. If you look at your skin without makeup, without all those effects, and this person you are showing me with flawless skin, with the same conditions, your skin is 10 times better than her skin.
yeah,
So
it's
yeah, it's very
exactly.
important, yeah, to be realistic and to explain to them what is the reality, what can we achieve and what we cannot achieve.
Yeah, and I think it's very important as well to focus on that when you're choosing your practitioners as well, um, because there's a lot of practitioners that will use filters as well,
Yeah, yeah,
and I I like to think that we need to be able to walk our talk, because
yeah,
if we don't, then how are we going to build trust?
definitely.
And that's always been one of my main focuses on my Instagram page, that it's never filtered, ever.
That's
I,
very, very true. That's very true. And I think sometimes people, clients, patients will learn it the hard way
mhm.
after going here and there, having some issues, problems, which sometimes might be long term.
Yeah,
So I hope that's why we are spending, I mean, the past 5 months while I'm staying at home, I did so many live broadcasts, lectures, teaching courses, and so on, just to spread the knowledge about those important facts, so that practitioner can be on the same page, do the same practice. Hopefully,
yeah,
I hope people get that, because at the end this will build trust, and
yeah,
people will be happier. And this is our role in the
exactly.
society.
Build trust, and it's going to save people money in the long run, because they just keep chasing the white rabbit.
Yeah,
And it's, and that's heartbreaking, because a lot of times by the time they get to me, um, they have already tried so many different treatments and machines and products,
yeah,
and
yeah,
they become very disillusioned. Um,
definitely.
so I think it's a very
Definitely, yeah, yeah. I mean, this is actually carrying a very important psychological impact in that field, because sometimes we see young girls who are very stressed, and they are very, very unhappy about how they look, and they want to look as those celebrities,
yeah,
while they don't have real problem or issue. So sometimes our role is just to reassure them and avoid having procedures which will make them uh, looking worse.
well,
Once I was in Kuwait, and I had a patient coming from another country, from Qatar, 18 years old girl, coming with her mother. What she wanted fillers in the lips.
yeah,
Why? I told her, your lips are looking so good without any problem. Why do you want to have fillers? She said, because all my friends in the school are having fillers, and they are always pinpointing me or bullying me why I'm not having fillers till now. So I
yeah,
said, but you don't need. If they have problems, if they have issues, if they envy you that you have better looking lips than them, this is their problem. It's not your problem. So
yeah,
actually, the honest practitioners is having a very important role in the society to spot those areas, reassure the patients, and make sure that they are not uh, subjected to procedures in which they are going to pay money and look worse
yeah,
than before, right?
yeah. And it's interesting too, because um, having larger lips my whole life, one of the things that I always focused on was I have larger eyes, I have larger lips, I have a larger nose, I have like my features were larger, so
Mhm.
they all blended together.
Yeah.
And I know that I've heard other doctors when they were when they were doing consultations for younger women who wanted to change the way that their face looked, the lips, and they would even say, which I don't know a lot of practitioners that are doing this, that if we were to augment the lip, your face does not match the lip. So we would have to augment in other areas to make it look normal. And these are young women. So now all of a sudden they don't even look like themselves, or they have these very large lips that do not match the face. So genetically, we are who we are.
Unfortunately, sometimes the plastic surgeons are having certain measurements for the face.
Yes.
So
the
what is exactly? So what is the ideal distance between the two eyebrows, or between the tip of the nose and the lip, and so on? Those are measurements. However, do you think that if God wanted to create us ideal in shape, he couldn't?
Right.
Definitely he could do whatever he wants, but there is a reason, and everyone is having a particular shape with particular measurements, and once we start to try to play with that, then people will not look normal. And this is actually the happened, and many people underwent plastic surgeries, and at the end they were very unhappy after what happened. So we really need to have the objective of restoring the normal, not creating something which does not belong to that person. This is a very important thing.
So important. And honestly, with all of my clients, it's amazing just by getting the skin to breathe again and to glow, how much more vibrant their personalities become and how much happier they are. And you're absolutely right. They could still, once melasma, always melasma. Their skin will not be perfect, but they haven't seen that beautiful glow in so long. That simple, just that simple little step is so, it creates such a happiness for them.
Actually, this is very true. And because today we are talking about menopause, this is an extremely important aspect, the psychological aspect, because during the time of the menopause, before, during, and after, there is a lot of psychological stresses and impairments in women. And one of the things which can help them is rejuvenation, when they feel that they are taking some time for themselves in order to improve how they look and how they feel. This is having an extremely positive impact on their lives. And actually, I have many of my patients who are friends as well, who are telling me, after what we have seen of transformation, improvement of how the skin is looking in a very natural way, we started to go to the gym, we started to have better diet, we are feeling really better. So it's really something which works when you are sincere, when you are putting yourself on their shoe and giving them the right advice, not just a matter of doing something quickly, get the money and run away. This is making huge difference in their lives.
Having that empathy and that understanding is exactly
very, very important.
And as a woman, you know, there's nothing worse than, you know, when your hair dries up and your skin, like, it just, you feel weighed down and dried up. And again, just as much as it's affecting these young girls and they're trying to change their looks, it's affecting older women as well, because they feel that they're going to be unimportant. That's a big thing now. They're going to be invincible. And it's kind of like, you know, that's the ticket, that's it. So if we can help to restore and bring some of that back.
Definitely. And this is something which should start actually much earlier than the menopause, Amy. Because now we started the new era of pre-rejuvenation. So we were talking about rejuvenation. Now we started another horizon, which is the pre-rejuvenation. Not wait till aging of the skin occurs, but now we can start much earlier in order to maintain what is good and keep it as long as possible, delay the signs of aging. And in this case, people will age gracefully without having the appearance of the changes happening to the skin with
Yeah.
aging. And this is something which I'm going to show you in the coming slides.
Yep.
So if you look at the skin is composed of three layers. The epidermis, this is the uppermost layer of the skin. And this is what we see when we look at each other. And this is what we see when we look at the mirror. Then we have the dermis, which is having the collagen and elastin. And this is very important for the firmness of the skin. And after that, there is a layer of fat in the subcutaneous tissue and fat, which is giving the skin the plump appearance. Each of those layers is undergoing certain changes with aging. And the aging, by the way, starts at the age of 20. So it's many people are not realizing that with the age of 20, we start to have atherosclerosis, we start to have collagen loss, and some changes will start at that age. If you look at the epidermis, the healthy epidermis is composed of 35% corneocytes and 65% living cells. Corneocytes are dead cells present on the surface of the skin, so that not each touch of the skin is killing few hundreds of living cells. So it's a layer of the cells, thin, it's supposed to be thin, not more than 35% of the thickness of the epidermis for protection. And under that, there is a thicker layer, 65% of living cells, which are responsible for all the metabolic functions of the skin, of the epidermis. Now, what happens is that, and this is of course the dermis, which is having the collagen and elastin, the hair follicles, the sweat glands, the sebaceous glands, it's the blood vessels. It's a very important layer of the skin. So when we are having someone coming for rejuvenation, what are the motivations? The motivations are going to be the changes happening in the skin. So the signs of aging, which can be sun and age spots, which can be the poikiloderma with some redness and pigmentation in the neck, in the chest, in the lower face, which can be rosacea. This is another thing which is common, and people are coming for improving the rosacea. Large pores, this is a very common problem. And when there is large pores, many people are thinking that this is due to loss of collagen. No, actually, it's a complicated issue. When we have a problem at the epidermis and the skin is losing water, then it is losing elasticity and pores will be larger. When the dermis is losing collagen, then there is less firmness of the skin and the pores are going to be larger. When we start to lose fat in the subcutaneous layer, then we are getting large pores. So it's not a simple thing. We need a combined procedure in order to improve the pores. Then the fine lines, which again occurs due to the defect in the barrier function of the skin and due to the collagen loss. Then skin laxity, which happens due to loss of collagen in the dermis and due to the loss of fat in the subcutaneous fat layer, which happens either due to weight loss, or it happens also during the time of the menopause, where there is redistribution of the fat. The fat start to increase in the abdomen, thighs, and buttocks, and this is coming from the fat from the face, neck, hand, breast, and arms. So the skin becomes lax on those areas, and the fat will increase in other areas of the body. So skin laxity needs some tightening procedures in order to improve. Then we get wrinkles, whether it is static wrinkles, which happens due to the loss of collagen and loss of skin hydration, but also the dynamic wrinkles, which happens due to increase in the tone of the muscles. Then we have uneven skin texture due to the unhealthy skin barrier function and the hyperkeratosis, and also the loss of collagen. And then we have the uneven skin tone, the color, hyperpigmentation, hypopigmentation, and then the roughness. We lose the smoothness of the skin because of the hyperkeratosis. And then loss of glow, which comes from the fact that the living cells of the skin are diminished. So we have impaired nutrition. So, and this is going to be associated with loss of volume. Those are the motivations of people to come with to ask for procedures for anti-aging. This is actually related also to the age. So we start to have people coming in the 20s for acne scars, as you can see. Then we have the sun damage, the lentigines, especially in very fair skin, where they start to have freckles and lentigines. And then we start to have the rosacea, the poikiloderma, the large pores coming. And then at later age, we start to have the skin laxity and the nasolabial folds and the age spots of the which comes again during the menopause. So those are different issues, and according to that, we can see different issues. This is an example of someone who's having photo damage. Without using the proper sunscreen, then you're going to have this kind of photo damage, and we can see the difference between the covered skin and the sun exposed skin. And that's why the sunscreen should be part of the daily routine in order to avoid the premature aging of the skin. When someone is not using the sunscreen properly and regularly, then this is going to increase the skin pigmentation, but moreover, it is going to enhance the destruction of collagen. And that's why people exposed to the sun without protection, they will have premature aging and they will have more wrinkles, especially with fair skin.
Okay, so I have a question for you with that,
Yeah.
because of course I agree with that, and I'm always making sure I've got my sunscreen on. But another point that I like to address with clients is that if they just, because we're naturally going to get a tan, that whether we've got sunscreen on, whether we've got we're sitting in the shade, the heat is always going to stimulate those pigment cells.
Yes.
Right?
Yes.
And so I like to always reinforce making sure that you are using something topically as well that is going to enhance the metabolic function of the skin so that we can help break down those pigment granules and digest them, assimilate them, absorb them through the body.
Of course.
Because not only is the sun breaking down the collagen and the elastin, but the weight. I always describe it to my clients as it's weight, the sediment of those pigment granules that are no longer active.
Yes.
And become dead and toxic in the skin.
Definitely.
And so, you know, that's why if I have someone say, well, I've got healthy skin because I hold on to my tan for a long time. Nope.
Yes. Yes. Yeah. That's very true. Yeah. Very true.
False, right?
Yeah.
So I just wanted to kind of reiterate that as well, because in that picture, that's exactly what I'm seeing as well. Is just it starts to collect and then separate, just like sand would, right? So
yes, that's very true. Let me just answer a question from Saba. وعليكم السلام يا صبا. البث النهارده باللغه الانجليزيه، ان شاء الله في خلال كام يوم هيكون في بث باللغه العربيه، فان شاء الله النهارده بالانجليزي. I was just explaining because some people are asking me to speak in Arabic or asking, so I'm saying that this one is in English, and in a few days there will be another one in Arabic. So okay, so we continue with the presentation. So another problem is the telangiectasia. So sometimes we are having people, because of the sun damage and the skin is becoming thinner, so we start to see some blood vessels like that, which happens with the sun damage. And this is something which definitely can be treated with laser. It should be treated with laser. It is not going to go away by itself, so this has to be treated, but this is a sign of photo damage. One of the important things, Amy, which we have to remember and we have to work on is that with aging in general, and after menopause in specific, we start to have slow microcirculation. And this is going to impair the oxygenation of the tissue. So one of the important things which we have to do, whether in the process of rejuvenation or afterwards after menopause, is to do a procedure which enhances the blood circulation, whether it's veins, arteries, or lymphatics. Because when the lymphatic circulation is slow, we start to have stagnation of toxic waste metabolized in the tissue with low level toxicity, and this will impair all the functions of the area which is having this problem. And that's why when you are having a device in your practice like microdermabrasion, like the silk peel, like the new Oxygeneo, where you are having a step in order to enhance the lymphatic drainage, in order to massage the skin, this is enhancing the microcirculation, and this is definitely improving the functions of the skin. So this is something which is important to remember and to practice in the process of rejuvenation.
Yes.
When we have a person like that who is having multiple issues, we have skin sagging, we have loss of fat, so we have laxity in the skin, we have senile lentigines, the sun spots, we have deep wrinkles, we have static wrinkles, and we have loss of volume. So in this case, it is not enough to do fractional laser or to inject Botox or to inject filler. You really need to work on all the layers of the skin in order to improve the situation. This pigmentation which is there, creams will not take care of it. You might need to do either chemical peeling or certain lasers, which is working for pigmented lesions like the Q-switched laser, in order to improve, or, and this is something which will happen during the consultation with the client. Some clients will tell you, I don't want to have multiple sessions. Please do one session for me, and I don't mind downtime. So in this case, we can do it with the Urban EX. So shave it off with the laser, which is having minimal downtime, but we can take off the pigmentation. Or some people will tell you, no, I don't want downtime. So in this case, we are going to do a Q-switched laser, which might need anything between 2 to 5 sessions in order to get rid of that with a specific laser, which is the Q-switched laser in this case. So you have to address all the problems, even though this patient might be coming only to complain of the pigment. But there are other issues which we cannot just keep silent about. It's very important to explain to the patients what issues they have, what is the plan we suggest, and it's up to them. Maybe they don't have the budget to do it, but at least we explained the situation in a sincere way.
Yes. So one thing I want to, because you and I have talked a lot about the new age of anti-aging, right? And how we don't focus enough on everything combined, a holistic approach. So, you know, we all have tools at our fingertips. But when I look at that face, in my professional opinion, I'm looking at what's the quality of that client's general health as well. Because if there isn't a healthy lifestyle combined with that, then how will she heal? How much of that pigment will actually be absorbed and brought through the lymphatic? I really like to stress that. And that's another big point about menopause, because we're starting to deplete in our, and I don't want to say in our health, but there's a lot of depletion that's going on in the body. So we have to focus on all that too, because that's going to change the outcome. If I have somebody that's very healthy, that takes exceptional care of their body, she might, with the exact same treatment and the exact same condition, she might heal or have a far better result than somebody that is on the other side of that, right? And then we have all the stages in between. So
that's very true, Amy. And because of that, when we are talking about rejuvenation, there are 5 cosmetic targets which we need to achieve. We need to remove the skin damage and improve the skin condition. We need to stimulate the cell regeneration, because with aging, we start to have slow regeneration of the cells. Then we need to improve the skin nutrition. And improving the skin nutrition is going to be through improving the nutrition of the general nutrition, the water intake, and some skincare products which can improve and enhance the nutrition of the cells. Then we need also to improve the cell functions, which deteriorated with aging. And then we need protection and anti-aging. So those are 5 elements we need to achieve. As practitioners, Amy, we cannot achieve everything. We can achieve only number 1 and number 2. So we do a procedure to remove the skin damage and improve the condition of the skin. And most probably this is going to result in improving of the functions of the cells, improving the proliferation of the cells, right? Those are the things which we can do. The remaining 3 cosmetic targets are the homework of the patient. And in this case, it is, as you said, it's a holistic approach. I definitely support very much the hormone supplements after
Yeah.
the menopause, because the concerns have been for so long that hormonal supplements after the menopause can cause breast cancer.
Mm-hmm. Mm-hmm.
Actually, the truth is, when we talk about this issue with specialized people, they will say that now the cancer breast survival rate is 5%. 5 years survival rate is 97%.
Yeah.
97% are going to live after the breast cancer for 5 years.
Yeah.
Now, one of the problems of the menopause is that they start to get decrease in the bone density, osteoporosis. So what happens is that if someone got osteoporosis and they fall, they might get a fracture in the neck of the femur. And with that, the survival rate for 5 years is less than 50%. So can you imagine that I'm risking my life, my well-being, my look, my everything, because of something which is just theoretical, and which is actually, if you look at the numbers, it is much less risky to have breast cancer than osteoporosis and fracture in the femur, with
Yeah.
all the complications which can happen with that.
Yeah.
So that's why I support having hormone supplements with the right, of course, supervision, because this is going to improve how the skin is looking. It's going to improve how they feel about themselves. It's going to improve the bone density. It's going to improve so many aspects in their life.
Yeah, and just to touch on that as well. So that was what Justin and I were talking about on Wednesday last week, as well as exactly that. But then we had touched on how there's different levels of the medicines, right? And so the cleaner the body is, and that's one of the things that I really try to stress with my clients that come into Smooth, is nutrition and being, putting some logic behind our food choices and trying to be as clean as possible, because the cleaner the body, then the more the receptors in the body will actually receive even a supplement in comparison to a medicine.
Definitely.
And
Definitely.
so, if we're afraid of taking medicines because of whatever,
the side effects, of course.
Then we need to do some other work, put a little bit more effort into it, and start cleaning up our bodies a little bit more, and start taking supplements. So, but that's just it. We really need to help our bodies along, because the impact of everything, aging,
this is definitely very important to take care of all those aspects, to have a healthy diet, to do exercise, to all those are very important things, and they go hand in hand in order to improve the situation.
Yeah, and I wanted to, because I know that Justin being a naturopath, and there's always doctor, naturopath, and I respect both of you so highly, and so it's nice to be able to have my favorite doctors say that, and favorite naturopaths say that, and it kind of combines. So
all they work together, and I strongly believe that keeping a healthy lifestyle as naturally as possible is the best way to achieve healthy life, beautiful skin, delay aging, and so on.
Excellent.
So let us continue with the so what happens if you look at this diagram, that the healthy skin, healthy epidermis, as I mentioned before, is having 35% corneocytes and 65% living cells. However, with aging, because when the skin is feeling that there is an insult coming from the environment, is going to increase the thickness of this layer of the corneocytes from 35% up to 60%, as you can see here. Why? To have more protection. There is injury coming from outside, so I'm going to increase the thickness of the dead cell layer in order to protect myself. But when that happens, the epidermis itself, its thickness is not going to increase. So when the corneocytes population will increase to 60%, this is going to be on the expense of the living cells, which are going to be diminished from 65% here to
Yeah.
down to 40%.
Yeah.
And when that happens, those people are not coming to us to tell us, I have hyperkeratosis, please treat me. No, they are coming to tell you the smoothness of my skin is much less, because when we have hyperkeratosis, this is called hyperkeratosis. When we have more corneocytes on the skin, this is called hyperkeratosis. So they will feel that their skin is dull because they have less living cells in the skin.
Mm-hmm.
So
Mm-hmm.
it is not viable. It is not healthy looking, because when we have less living cells, and nutrition is impaired, and the skin is not looking viable and healthy. And also they are going to complain of a very interesting thing, Amy. They are going to tell you, I'm using the best skincare products, but nothing is working, because the epidermis is like this photo here on the left. So we can see that it is covered by thick layer of corneocytes, which are dead cells. So if we apply something on top of the skin, it's going to be consumed and absorbed by this layer, which is working like a sponge. Absorb the products. It is dead cells. It's not going to be affected or taking that product. And whatever penetrates will find less number of living cells to work on. So the effectiveness of whatever we apply on the skin in that condition is going to be very poor.
Yeah.
Right?
Yeah.
The
Well, and
yeah.
that's the same too when you're doing a chemical peel on that type of skin. It's very intense because it's like a fire and dry brush. It's like throwing a match outside right now.
Exactly. Very true, because the skin is very unhealthy, because we
Yeah.
mentioned that this is not the only impairment, but also when we have poor circulation, poor lymphatic drainage, the skin is in a toxic status. So if you do something harsh without the right preparation, without the right way, the reaction of the skin is going to be very aggressive.
Yeah.
Right?
Yeah.
What we are seeing now here is the hyperkeratosis. When the skin is under the electron microscope, when we have too much crowded corneocytes, the skin is not having intact barrier function. Why? Because as we can see, the overcrowding of the cells will not allow to have good closure of the skin. So we'll have gaps, cracks, which are allowing the transepidermal water loss. The skin is vaporizing the water. And in this case, there are several issues. Number one, those people are coming to complain that their skin is becoming very sensitive. Whatever they apply on the skin is irritated. They never had sensitive skin, but now it's sensitive. Why? Because we have damage in the barrier of the skin. So anything will go in and will stimulate an immune reaction. So this is a situation where it's causing allergy, it's causing dermatitis, it's causing erythema, a lot of issues of the fragile, sensitive skin. This is a common. Yeah, this is a common.
Very important. Yeah, because people think that they have skin disease, which is a disease, but it's a condition. It's not a skin type.
Exactly. Thank you very much. Also, they are coming to tell you, I have frequent infections of the skin, viral, bacterial, and fungal infections. Why? Because the barrier function of the skin is disturbed. The skin is open. Any microorganism can go inside the skin, invade the skin, and cause pathology, cause a disease. The third and the most important thing is that those are the people who are having structure like that, who are coming to complain of skin dryness. Why? Because when the skin is open, there is transepidermal water loss. The skin is vaporizing the water. And the problem is that when they are having this issue, the skin is losing elasticity. This is a photo which I always like to show. This is a baby who is having gastroenteritis. So the baby is having vomiting and diarrhea. And this is a test where we teach the parents to, when your child is having this problem, every now and then you have to pinch the skin of the abdomen. If it does not retract like this is a sign of dehydration. You have to rush to the hospital. This baby requires intravenous fluids. And this is a serious condition. Now, this demonstrates the importance of the skin hydration on the skin elasticity. When the hydration is impaired, the skin elasticity is lost. And this is a test which we can perform where we pinch the skin in the dorsum of the hand. When it takes time to retract, this is a sign of dehydration. So this is something which shows us that we might need to do something.
Yeah, now, I do it sometimes too under my eyes. So if I'm fatigued
Yeah,
So
exactly.
that's a really good trick for some women as well, is that if you can just kind of just pinch the skin and you'll see how long it takes for
Exactly. This
a
is a
skin
very
to come
good
back.
examination, but actually it's going to be positive, Amy, only if we have a significant degree of skin dehydration. In
Yeah.
many cases, the problem is just on the microscopic level, as we can see in this photo in front of us. And so many people will do the same test, will pinch the skin and tell me, see, it has retracted very quickly. But it doesn't mean that they don't have impairment of the epidermal barrier function. Because
Yeah.
if it is on the microscopic level, there's definitely transepidermal water loss. There is definitely impairment of the skin elasticity, which is going to be shown in loss of smoothness of the skin. It was going to show in form of large pores. It's going to show in the form of fine lines and wrinkles. Once you improve the skin hydration by improving the structure of the epidermis, then the skin elasticity is going to be restored and the skin is going to be smoother. The pores are going to be smaller and the fine lines and wrinkles will go away just
Yeah.
simply by working on the epidermis.
Yeah.
So when we have someone who is having a configuration like this, we have to work on the epidermis with different technologies. We can use chemical peels if we have the skills, we know how to prepare the skin before and after. We can use retinol, and I know that you love retinol. It is something which normalizes the epidermis. I love microdermabrasion with different versions, like Oxygeneo, like the silk peel, like the different technologies used mechanically to improve that. And I like those devices because they are not only improving the structure of the epidermis, however, they are enhancing the microcirculation as well. This is something even the laser doesn't do. So another option is to use ablation with the erbium YAG in order to remove those dead corneocytes, and this is going to stimulate the basal layer, the living cells, to proliferate. So we are able to improve and return the composition of the epidermis back to normal like here. However, if we do it with laser, or if we do it with chemical peeling, or even if we do it with retinol, those techniques are not going to improve the microcirculation. When we do it with machines which are having vacuum and massage, besides improving the structure, it is going to improve also the microcirculation. And that's why
Mhm.
this is one of the technologies which I really like, to have devices which are enhancing not only the structure of the epidermis, but also the microcirculation and the lymphatic drainage in particular.
Yeah. Yeah.
There is a question about the best technique for the hand rejuvenation. And this is, Amy, one of the points which I really wanted to mention. People focused on the face and on the neck, but then after few years, when they keep being regular on that, and they really look much better than their age, whenever they are doing something and they put their hands beside their face, then the hands is going to tell all the truth. And
Yes.
that's why hand rejuvenation is becoming a very important interest. And whatever is applied to the skin of the face is applied to the hand. So we need to go in a systematic way. So this is in front of us. We have seen how can we improve the epidermis, and in this case the skin is going to be looking much more viable because we increase the number of living cells, so the nutrition improved, and the hydration of the skin is going to be restored, and whatever we apply on the skin is going to be much better absorbed, so everything is going to be looking much better. In many cases, people are coming to complain of things beyond the surface of the skin: melasma, acne scars, large pores, wrinkles. However, if we have a good examination of the skin, we'll see that the epidermis is impaired and we have to do something for the epidermis.
Yeah.
Definitely, this is required in every single client or patient we are going to see,
I,
regardless of the complaint.
it looks like we only have 50 seconds left.
Really? Okay. Is that true?
I don't know. It might cut
Okay.
out. It's
I'm
it's
going. If that
42
happens,
seconds remaining.
we are going to have another one. We'll continue. But
Okay.
before I finish, when we are combining the treatments for the different layers of the skin, then we are going to see someone like that, who is looking like that on the left photo and looking like that on the right photo. And if I ask you, Amy, which photo is younger, I think we are agreed that the one on the right is looking younger than the one on the left. But
Yeah.
the reality is that this was in 2012, and this was in 2015. So here she was 68 years old, and here she's 71 years old. So 3 years older. However, she's looking